Hello everyone, my name's Tanmay Swadia. We're here for the FIT blog at the ACC 2014 at Washington, D.C. And I have the honor today of speaking to Dr. Robert Bonow. Thanks for taking the time to talk to us today, Dr. Bonow.
Well, thanks, Tanmay. It's great to be back at the ACC meeting. I've been coming here every year for the last 37 years. Gave my first abstract presentation here as a fellow back in 1970-something, and I've been coming back every year since. It's really great for fellows to come to this meeting because no matter what you do with your career, academics, practice, something in between, networking is so important. Staying abreast is so important. Great clinical trials, great research, great ability to work, to get to know people, develop your careers and your contacts.
Well, we are in 2014, and I have to ask you this question. How do you see the structural interventions for valves fitting into the guidelines? How do you see that?
Well, we're seeing it already. And of course, today we saw the late-breaking clinical trial of the core valve data, which was very exciting, well presented. We're already seeing it entering into our guidelines. The 2014 guidelines do address the application of both TAVR for aortic stenosis as well as the MitraClip. So fellows interested in careers in structural intervention, there's a lot going on and a lot to look forward to.
So you think, is that true to believe that CT surgery is almost going to be taken over by interventional cardiology, or that's an overstatement?
I don't think the surgeons have to worry. I think there's going to be an aging population with lots of risk factors that clearly are going to need some kind of advanced treatment, and surgery will always be, I think, the gold standard for outcomes of our patients. So no, surgery is not going to go away. I don't think we're going to be taking away too much business from surgeons. In fact, if you're involved in structural intervention, those programs tend to attract more patients, including many patients who are candidates for routine cardiac surgery.
Well, and one final question to you, Dr. Bonow. What advice do you give to all the fellows out there in training right now?
It's hard to make that a short statement, but a short statement would be keep abreast of what's going on. Come to meetings such as this because this is where the action is, this is where you network, this is where you find people who could be your mentors for the next several years or for the rest of your career. But there's lots of excitement in cardiovascular disease, lots of things to do, and a great future ahead for our fellows.
Thank you very much for, again, taking the time to talk to us today.
Thanks, Tanmay.
Thank you. And I hope to see you guys we're all on www.youtube.com/fitsonthego.